I'm very excited to announce our new course that's coming up on how to treat patients with temporomandibular disorder or TMD, as well as idiopathic condylar resorption. Both of these conditions are very common. Idiopathic condylar resorption is becoming more and more common throughout the world, and we see more and more cases, but temporomandibular disorder is very common. If you're a general dentist or even a pediatric dentist or a orthodontist or an oral surgeon, you see a lot of these patients, and actually many of these patients are undiagnosed or misdiagnosed. So it's very important to know how to diagnose and treat these patients. In this course, we're going to go over step by step what are the warning signs, how to screen these patients, how to diagnose these patients, what kind of diagnostic tests you need to do. We're going to cover CBCTs, MRIs, blood tests, clinical exams, and what diagnostic records you should take to treat and diagnose these patients. So we're going to go through the screening process, we're going to go through the diagnostic process, and then we're going to go through the step-by-step treatment process for each of these patients. We're going to talk about displaced disc. It's very common that TMD patients have enterally displaced disc with or without reduction. Some of these patients have a ligament that's torn. That's very common too. Some of these patients have chronic problems. Some of these patients have acute problems, as well as we're going to go through the pain management aspect of it too. We're also going to cover how to treat patients and how to diagnose patients with idiopathic condylar resorption. And we're also going to go through the related problems to these conditions. A lot of these patients don't just have TMD or idiopathic condylar resorption, but they have many other problems. Oftentimes chronic pain, but also they could have other problems too. For example, many of the TMD patients or idiopathic condylar resorption patients have rheumatoid arthritis. So it's very important that you know how to screen these patients, how to diagnose these patients, how to treat them, or if you happen to not wanting to treat these patients, at least you know how to do the workup, and then you can refer these patients to a place where they can be treated appropriately. So it's a very exciting course, and it's a topic I really like. I have taught this course both in the US and in Europe, and it's been getting great reviews. So I'm really excited to now offer it via Zoom, so it's more convenient for doctor to enroll in it, and you can watch it from the comfort of your home. So make sure look out for dates, and we're excited to have you in this course. And if you have any questions, of course, send me your questions. We're gonna make I always make these courses very interactive. I like to answer all of your questions. We're gonna have breakout sessions. We're gonna talk about frequently asked questions, and make sure bring all your questions to this course, and we're going to go through everything step by step. And I promise when you're done with the course, you'll be able to diagnose, screen, and treat these patients very effectively. Okay, see you there. Bye.